Well, the study suggests there are at least two and probably many more both known and unknown factors at work. First, what the study shows is not only a change in the natural history of dementia, people are less likely to get it, but also a change in the natural history of vascular disease. Over time, people were more likely to change behaviors that can increase the risk of vascular disease, such as reducing their use of cigarettes, smoking. They're also more likely to be pursuing treatments for vascular disease, such as antihypertensive treatment and anti-lipid treatment. And they're also getting more treatment for vascular events, such as treatment after strokes. And the study suggests that all those summative efforts may explain why the risk of dementia over the last 30 years has been declining. Because in particular, what the study shows is that the risk of dementia caused by vascular disease explains most of the decline in the dementia risk. The study also has another provocative finding, namely that this reduction in the risk of developing dementia was only seen in individuals who had at least a high school education. That's a very interesting finding because it's saying that an exposure that's occurring between no later than the ages of 18 and 24 years of age, ends then, has a real influence on your cognitive health 50 years later. It recapitulates data about the value of education in developing a brain to be a healthy brain lifelong, but it also recapitulates data how education leads to subsequent social and economic opportunities or lack of opportunities that can influence health and well-being with aging. Well, clinicians should be saying to patients what more and more evidence is suggesting, that if you can keep your heart healthy, you can help to keep your brain healthy. So habits which we know are good, like regular exercise, a heart-healthy diet, and identification and reduction of common risk factors for heart disease, like smoking, elevated lipids, elevated blood pressure, that addressing all of those may not simply help prevent the dreaded diseases of the 20th century, heart attacks, stroke, sudden death, but may also help to prevent the dreaded disease of the 21st century, namely dementia. I think that policymakers also can take a lesson from this. Namely, this study shows that efforts to project the future prevalence or amount of people with dementia need to be revisited. Currently, our approaches rely on using a static estimate of what the risk is. We assume the risk now is the risk that it will be 30 years from now, and using that, we project how many people will have dementia 30, 40 years from now. This study, which shows that the risk has actually been changing over time, means that future estimates of the prevalence of dementia, that is to say how big is the problem, are going to need to account for changes in the risk. So we're going to have to switch from simpler methods to probably some more complicated microsimulation methods, so that our national plan for Alzheimer's disease is informed by good data about whether the prevalence is going up more than we thought, going down, or staying the same compared to what we thought it was going to be.
Right foot red and left hand